Have anyone seen my video on Mounjaro? What do you think, women, about Mounjaro? I mean, what will your reasons be for taking Mounjaro? Mounjaro is a weight loss jab. It's a GLP-1 agonist, meaning that it's usually used for people who are type 2 diabetic because it increases your insulin sensitivity. It also has this peptide called the GIP, which means that it helps to regulate your gut hormones. And so Mounjaro for weight loss is quite popular. There's been a lot of requests, for Mounjaro. In fact, I think supply is basically not able to keep up with the demand. In the UK, we have safeguards for women who can take Mounjaro. So you have to have a certain BMI to be able to take Mounjaro. Now, you have women who think that they're fat, but they're not actually fat, or let me use the politically correct word, women who think they're overweight or obese in their own minds. Because when you do the weight calculation, let's say we check your BMI. If your BMI is 24, 25, that's overweight, right? Actually, 25 plus is classed as overweight. So between 25 to maybe 27 point something is classed as overweight. However, you would not qualify for Mounjaro because you do not meet the criteria in terms of the BMI. But everybody wants to be on Mounjaro now, and you can get it privately. I think the private clinics have a lower threshold for prescribing Mounjaro because it's all about the money. As long as you've got the money, private clinics have no issue with giving you Mounjaro, regardless of your BMI. But if you're going to get it through the NHS or through your doctor, there is, all these red tapes, there's barriers, there's hoops you have to go through, to get the Mounjaro. So your BMI really should be 30 or over to be able to get Mounjaro. Also, if you have an underlying condition, then they will consider giving you Mounjaro at a lower BMI. So if you have a condition such as maybe type 2 diabetes, you have high blood pressure, you've got obstructive sleep apnea, you've got, high cholesterol, these are some of the underlying conditions where it will be considered a lower BMI than 30. So the range for this will be between BMI of 27 to 30, at which they will now consider giving you Mounjaro. Now, Mounjaro is seen as this wonder drug that, oh yeah, look, I've lost 5 pounds in 2 weeks, I've lost 10 pounds in 2 weeks. You see all these on social media, but you know what, there are pros and cons to losing weight so quickly, and weight loss has to be steady. If you lose weight too quickly, you're at increased risk of having, conditions like gallstones or pancreatitis, because your body is simply not able to cope with the weight loss. The body's metabolism is just happening too quickly for the body to be able to cope. So it is very important that you try and lose weight steadily and not very quickly with Mounjaro. Now, Mounjaro has side effects. There's so many side effects, The most common side effects tends to be with the gut. We're talking side effects such as nausea, vomiting, diarrhea, but you can also feel, other side effects such as headache, feeling flushed. I know a woman told me she took Mounjaro and she fainted and she had to go to the hospital. So these are the sort of side effects Mounjaro can cause. I also mentioned the pancreatitis and the gallstones that you can also get, with Mounjaro. If you know any other side effects that you have experienced, Mounjaro, does it cause thyroid cancers? Why are they saying you cannot take Mounjaro if you've got a form of thyroid cancer called medullary thyroid cancer? That's the question. So there's certain questions that need to be answered, so that the longer you are on the drug, the more risks that there would be in terms of these rare, consequences, such as, can I get medullary thyroid cancer if I take Mounjaro? So they normally advise that if you've got medullary thyroid cancer, you should not take Mounjaro. If you're type 1 diabetic on insulin, you should not take Mounjaro. If you already have, pancreatitis, you should not take Mounjaro. If you have acute kidney injury, you should not take Mounjaro. What's the other one? There's another contraindication to take Mounjaro, which has just slipped my mind. Yeah, that's it. Gastroparesis. Now, gastroparesis is basically a condition where the food does not go as quickly as it should do through your gut. So the food goes very, very slowly. And that can cause problems because your body is not metabolizing the food properly with gastroparesis. So you get vomiting, you get abdominal pain, You know, you sometimes have change in your bowel habits. So if you have gastroparesis, which can also be a consequence of type 1 diabetes complication, you should not take Mounjaro. Okay, so Mounjaro basically is actually the best out of the Ozempic and Wegovy, because no one's talking about Ozempic and Wegovy now, are they? Because you lose weight more with Mounjaro than you will do with Ozempic and Wegovy. Those are the other injections. And also with Mounjaro is more of an appetite suppressant. So it suppresses your appetite because it works on centers of the brain. However, Ozempic and Wegovy do not suppress your appetite. So that's the difference of these medications. So what happens? Mounjaro will reduce your cravings for food. It works on the brain centers that causes hunger, so you don't feel hungry when you're on Mounjaro. Whereas with Ozempic and Wegovy, the reason why they're not as effective is not that you do not lose weight with it, it's because they do not suppress your appetite. So you can take Ozempic injections, you can take Wegovy, like Mounjaro, you have less cravings for food compared to Ozempic or Wegovy. You might not be someone that wants to take injections. Maybe you've had their contraindications, as I mentioned, to you taking these injections, whether it's Ozempic, Wegovy, or Mounjaro, and you're wondering, what else can I take? Okay, there is another medication called Orlistat. Has anyone heard of Orlistat? Yeah, I'm British. Have you ever heard of Orlistat? Orlistat used to be the only medication back then in those days. You know, my younger days when I was a doctor, you know, a junior doctor training, Orlistat was the only one we could recommend because it was the only one in the market. We didn't really have, I mean, you still had your Ozempics and your Wegovy, though they came under different names, but they were not licensed for weight loss. We're given to type 2 diabetics who were not responding to your usual treatments like your metformins and your glycosides. However, they were not. No one thought, oh, actually, we can give these injections for weight loss. So back then, we only had Orlistat. Now, Orlistat works, but Orlistat works slowly, okay? So with Orlistat, we're talking about 3% of body weight in 6 months, yeah? So if you compare 3% of body weight in 6 months with 20% of body weight in 6 months with any of these injections, whether it be Ozempic, Wegovy, or Mounjaro, there is a big difference. And remember, with Orlistat, you cannot just take Orlistat and lose weight. You have to exercise, you have to change your diet, because if you eat fatty foods with Orlistat, you're going to have oily stools. I know someone who told me when they took Orlistat, they were not eating fatty stools, but they still got oily stools anyway. I know it's 8 a.m., but I'm driving to work. It's a long journey, so I thought, let me just, you know, educate anyone who's awake about these weight loss injections, because they're quite popular. So apologies if I'm waking anybody up from the sleep. I'll try not to make that a habit. What was I saying about Orlistat? Also with Orlistat, as I mentioned, it can cause fatty stools, it can cause abdominal pain, it can cause cramps as well. And also it's a tablet that you have to take. A lot of people are not fans of taking Orlistat just because of the side effects and just because it doesn't work as well. But it does work, it does the job equally for anyone who cannot take injections, you know, for any other reason. So I'm just letting you know that you've got a choice. You've got choices here. It's not just Wegovy's, Ozempics, and Mounjaro. There's another one called Saxenda. I'm not too familiar with the Saxenda one, so I'm not going to talk much about Saxenda because there's just too many weight loss jabs and tablets and everything coming out. There's another injection which I'm going to look into, and I'll do a topic on that. It's actually said to be better than Mounjaro. Yeah, it's going to be better than Mounjaro, and I will do a video on that when I've got the time to do that, because I don't usually have time to do videos. But this is going to blow your Mounjaros and Ozempics and Wegovy out of the market. This is going to be never ending. There's going to be new jabs coming up. So you'll be talking about losing 50% body weight in 6 months with this weight loss jabs. Yeah, so what else can I say about Mounjaro? It's like any other injection in terms of, if you stop it, you could easily gain the weight you have lost. And that's why it is important to keep on with the lifestyle. Not a lot. You see all the celebrities, they're all cheating, you know. They won't tell you that they don't exercise, your Kardashians and whoever else takes these injections. They don't tell you that they don't go to the gym. They don't tell you that they're not really eating the street, street cabs, Mediterranean diets, those sort of foods that will help you to lose weight. They're cheating. So everyone's cheating, quick weight loss, and that's all good, because you need to achieve a certain goal, but it will come back and bite you. Okay, so basically, welcome back, Chunk. So to come back and bite you, so basically all I'm saying is just be true to yourself. I'm not here to promote weight loss jabs or any type of weight loss tablets. I'm just letting you know the pros and cons. Let's talk about the doses. So a lot of people are asking, how do I dose on Mounjaro? Mounjaro comes as a pre-filled injection pen. I'm sure you've seen it. It's like those things that you can either use it on your upper arm, you can use it on your abdomen, you can use it on your thigh as well. So you need to use it in areas that have got a lots of subcutaneous fat. I should do a donor button. Look, I'm new to this live thing. I don't know how, I'm just playing with this live video thing. I don't know how to do a donor button, but thanks for the suggestion. That's the thing I should have a look into. So it's best to inject into the areas that have lots of subcutaneous fat. So I was saying the upper arm, the abdomen, your upper thigh as well. Also, one of the side effects I forgot to mention, skin reactions around the injection site. So don't apply to the same site all the time, because you can get like rashes around the injection site. That's one of the side effects you can get with injections. You can get like fatty lumps around the injection site as well. So always change, the sites if you're using the injection. So pre-filled pen, 2.5 milligram dose. So you start with a 2.5 milligram dose for the first 4 weeks. Women, I'm going to talk about contraception. Remind me, I'm going to talk about contraception with the with this Mounjaro injections, or any other injection that you take for weight loss. But let me just talk about the doses. Again, I've got a more concise video where I spoke about Mounjaro on the YouTube channel. So if you want a good summary about everything I've talked about, you can check my video on which women should take Mounjaro. I also have another health channel called the Caring Medic. So the Caring Medic, I talk to my YouTube channel. So I'm getting distracted. Okay, 2.5 milligram dose. You'll use this for 4 weeks. After 4 weeks, provided side effect, now increase to a 5 milligram dose. Okay, so you're going from 2.5 to 5 milligram dose. You take that for another 4 weeks, and then you can increase by 2.5 milligrams. You do that every 4 weeks till you get to 7.5, you get to 10 milligrams, you get to 12.5, and then 15 milligram dose is the highest dose. So every 4 weeks, you're gradually increasing those by 2.5 milligrams. The maintenance dose is usually between, say, 10 to 15 milligrams dose. Some books you read would say 12.5 to 15 milligrams is a maintenance dose. But some women are happy to stay on 10 milligram dose because they're achieving the weight loss that they want to achieve on 10 milligram dose. Does your work with bees? What does that mean? Does your work with bees? So most women have noticed that they lose significant weight on the 50 milligram dose, which I said takes about anything between 6 to 8 months to lose 20% of your body weight. Now let's talk about contraception. If you're on the combined contraceptive pill and you take Mounjaro, your contraceptive pill might not work because Mounjaro reduces the effectiveness of the contraceptive pill. So if you're going to stick to the contraceptive pill, you need to make sure that you're using a barrier method of contraception, such as condoms, alongside the contraceptive pill, or you might need to change to a different type of contraception, such as maybe the IUD coil or the implants or the injections, but you need to take something that you do not take by mouth, which is the oral contraceptive, because it's most likely that you are going to fall pregnant if you are not planning for pregnancy. So if you take Mounjaro injection for the first 4 weeks, you need to change your contraceptive pill or use barrier method for the first 4 weeks. After starting the injection, for the 4 weeks on 5 milligram dose, you need to be on a different form of contraception. So what that means is throughout the duration you are going to be on an alternative form of contraception. Also, why it's important to look at the contraception. Some women have conditions such as polycystic ovarian syndrome. They're thinking, oh, I'm not going to fall pregnant because I have an underlying condition. There's more chances that you are going to fall pregnant because the Mounjaro injection increases, which makes you more likely to fall pregnant. And polycystic ovarian syndrome, there are issues there with increased insulin resistance. So Mounjaro is actually good for treating conditions like polycystic ovarian syndrome, which is a condition where basically you have increased insulin resistance, you have irregular periods, you might have acne, you might have increased hair distribution in certain areas such as your chin, you know, your chest and your abdomen. You know, so those are some of the hallmarks of polycystic ovarian syndrome. So women, if you have to go on contraception because you might fall pregnant. So again, hi Jana, you've missed my whole talk, but this will all be recorded, I think, and then you can watch this later in my Women's Health channel. This is all I've got to say about the Mounjaro injections. If you have any topics you would like me to present, please let me know. I hope you enjoyed this video, and please subscribe to my channel. I love you all, and thanks for watching. Take care, guys.